Digital Health Agency.
It is now emerging that there were discrepancies in the payment of stipends to community health volunteers in the last fiscal year, despite a 70 million shillings budget set aside for this payment.
At Narumoro Level 4 Hospital, they have been offering services for the last financial year. If I calculate their stipend, it's supposed to be 70,140,000. Who are these other ghosts that are being supported in Nyeri? So this information is not coming from the field, it is coming from the ministry. There are disparity in figures.
Unable to explain conflicting figures regarding to the number of community health CHPs and the disbursement of funds, Public Health and Professional Standards PS Mary Muthoni found herself hot on heels when she appeared before the National Assembly Health Committee, as she responded to questions about the 121,000 CHPs listed in the ministry's database.
Out of the 100,000 that you had actually enrolled, you have a deficit
of 4,000.
About 3,000 to 4,000.
The issue of the numbers, I have said that it would be important to go back and interrogate the system again, because this statement is actually misleading. All of us.
Admitting to challenges in the rollout of Social Health Insurance Fund SHIF due to system instability during its first month of rollout, Elijah Washira, the acting CEO of the Social Health Authority, explained that individuals categorized as indigent will be required to undergo means testing to determine eligibility.
Those indigents showed that indeed there are people who were supposed to pay much more than they were paying. So some government was paying 500 shillings, and if their lifestyles and others were looked at, it came out they fitted in the category of 1,700. What the SHE Act says, Honorable Chair and Honorable Members, is that everybody will go through the means testing process. When the means testing process
that is not in the Act.
However, under the new chronic critical fund, 95% of NHIF cancer patients who previously exhausted their coverage and paid out of pocket will receive support.
For cancer patients, the data that we had was 95% of patients who were seeking NHIF cancer benefits were using less than 400,000. That's the first thing. The second thing is the reason why we have the emergency chronic critical illness fund was so that anyone who exhausts their benefits at the shift contribution level is supposed to transition to the emergency chronic critical illness fund, which is appropriated by Parliament.
To date, 6 million Kenyans have successfully transferred their data from NHIF to SHIF, and an additional 7 million individuals who were not previously in NHIF have completed their SHIF registration through the USSD code and SHA website. SHA has processed pre-authorization claims worth 2 billion shillings, with 169 million shillings already cleared for payment in its first month of operations. Bentura Kwamboka, K24, Nairobi.